This is Jeremy with Chiropractic Clarity, and in this video, we'll be going over the clavicle. The clavicle is the correct anatomical name for what most people know as their collarbone. It's S-shaped and bears various different bony anatomical features. To start, we have the sternal end. The sternal end of the clavicle is going to articulate with the sternum, forming the sternoclavicular joint. This joint is a saddle-type synovial diarthrodial joint. On the other end of the clavicle, we have the acromial end. This end articulates with the acromion process of the scapula, forming a plane type or gliding type synovial diarthrodial joint. But these two ends aren't the only bony features. If we look at the inferior surface of the clavicle, we see this big bony prominence, known as the conoid tubercle. From the conoid tubercle, projecting towards the acromial end, we have a trapezoid line. And around midline of the clavicle on the inferior surface, we have what's known as the subclavian groove. Now, to get oriented with the clavicle and determine whether it's left or right, we have three important features to look at: the conoid tubercle, the acromial end, and the sternal end. Understanding that the conoid tubercle of the clavicle is on the inferior surface, we can then determine which end is lateral and which end is medial. The acromial end sits lateral and the sternal end sits medial. Therefore, this is a left clavicle.